Hi friends, today very briefly I'll give you an overview of type 1 diabetes in children. So type 1 diabetes, we know it's not a very common disease. In diabetes, it's a type 2 diabetes which is more common. But type 1 diabetes is important because it affects the children in a very early stage and it has severe complications. The prevalence of type 1 diabetes in India is about 30 patients per 1 lakh population, and the cause of diabetes, it's multifactorial, but type 1 diabetes is basically the genetic, environmental factors and some viral infections which can start an autoimmune process. This autoimmune process in the body, what happens is that the immune system of the body, it starts attacking the pancreatic cells which produce insulin, and that causes the deficiency of insulin. So the symptoms of diabetes, type 1 diabetes in children can come or start coming at around 4 years of age, and about 40 to 50% of children are diagnosed with type 1 diabetes by age of 15 years. Later on, it can go up to even 20 to 25 years also, the diagnosis can be made. The symptoms of this disease comes in children as excessive thirst, excessive urination, weight loss, fatigue. At times they can complain of blurred vision, and in very severe cases they become unconscious and come in a state called diabetic ketoacidosis, which can be life-threatening. The management of type 1 diabetes, it basically includes insulin injections and glucose monitoring to adjust insulin doses frequently, other than the basic a good diabetic diet and regular physical activities. In children, what happens is it's more important to manage diabetes in school as well. So diabetes management program in school, it's a collaborative effort between the parents, the school staff and the healthcare team. The school staff or the school dispensary having a nursing assistant, they should be trained in recognizing and treating hyperglycemia or hypoglycemia symptoms. They should also have a hypo box which should contain injection glucagon and fast-acting carbohydrate like glucose tablets or some snacks as well. The staff should be trained in giving injection glucagon. The patients should also be able to monitor once they are mature enough. They should be able to monitor and adjust glucose, the insulin doses by themselves. So with a good education, good glucose monitoring, and after the child matures and is able to adjust insulin doses, the patient can lead a healthy life and a productive life. Thanks.